Vertical events acknowledge the traditional owners of the land on which we meet today, Wurundjeri Woi Wurrung and Burn Wurrung Bunurong peoples of the Eastern Kulin Nations, and pay our respects to elders past and present.
Thanks, James, for the opening video. Great to see you all here back at Melbourne. Now, I want you to be honest with me. Did anyone wake up today, thought, you know what, got TechKnow and Best Roadshow, I'm going to head down to Collins Street and Russell. That's where they've always held the show. Anyone make that mistake? Yeah, Vince, like your honesty, mate. Isn't it great to be at this brand new, well, refurbished hotel, the old Ridges Melbourne, but it looks amazing. And we're really pleased to be here. As many of you, because I've seen you throughout the many years since 2015, since we've been doing TechKnow, would know we have held every single Melbourne leg of TechKnow up until today at the Grand Hyatt, and they were unavailable, and what an opportunity it is to be here at this brand new hotel. So it's great to see so many familiar people here. As you would have been aware, because our registration ladies would have advised you, there's another tech company, reasonably well known, not as well known as our participants, but a company by the name of IBM. They've got a show that's happening next door. So we just need to be respectful of their delegates and got to try and contain ourselves in our area, which is that precinct. But if you do need to use the bathrooms, we're all sharing it with the IBM people. But isn't it good to be back in Melbourne? As some of you be aware, we held the Sydney leg yesterday. We had a great show. Actually had the biggest audience of investors that we've ever had for the Sydney leg of Melbourne. So it really shows that the investment sentiment has shown a lot of strength in this biotech and tech space. And as you know, we do a lot of work in the resources industry, and we've kind of seen a shift in investment sentiment. You know, like we could put a lithium conference on and there'd be 1 million people here. Now, if you put one on, there'd probably be 5 people here. No, there'd probably be a lot of people here, and they'd be asking a lot of questions why the share prices are down. But it's great to see this very strong sentiment in tech and biotech. And it's also really exciting to be back in this great city. Now, we got any Essendon supporters in the crowd? Yes, I know you two are there. Big game this weekend against the mighty Fremantle Dockers, so we'll see how that one plays out. It's good that the Dockers decided to rest Fifey this weekend, thanks to the AFL. But looking forward to talking a lot of great tech and biotech and a lot of fun with you all. The Melbourne leg is by far our most favourite leg of TechKnow, and I didn't say that in Sydney yesterday, but it is. We've had such a great time with you all for many, many years, and we've presented so many great companies, and we're looking forward to the 19 companies that are presenting today. But as you all know, a show like this wouldn't exist if we didn't have the great sponsors. And for those of you who have been to many of our conferences over the years, you would have seen the Lynn Partners up there. They are based in New York, and they just take a blanket spread sponsorship of all our conferences, and we're very lucky to have amazing support from them. Occasionally, and when I say that, that might be once in 5 years, they may fly out and just see if we're actually holding these events. But we're very lucky to have the great support from Jeff Easton and his company, the Lynn Partners. We're also lucky to have the Links advisors, and Joe and his team will be floating around today. They've been sponsors of TechKnow over the last couple of years since post-COVID, and we really appreciate their support and the assistance that they have in getting a lot of their investment clients to participate. There's Steiner Price Paganin. Toby Hicks will be up on the stage later on today as part of the panel. He's also the chairman of Digital X, who are presenting, and that is a very, very exciting story. Actually, the best thing about TechKnow is the diversity and range of companies that present. And I'm sure you guys will really, really enjoy this day as it plays out. Then we've got our media partners, Chapter 1. Dave Tasker's been part of the journey since the first day. We appreciate his support. He and his colleague Jed will be managing the live streaming, so big shout out to all those people that are live streaming today. There's Investor News Network. Their support is great in disseminating the information about TechKnow to their clients. And then we have Market Tech, and you may have had a chance to meet Chris. He's at the back of the room. He's got a little computer screen that he can run through a demonstration about what Market Tech provides. But essentially, think of this, right? This is the ideal trading platform. So if any of you use Comsect or Bell Direct or E-Trade, get rid of those and move over to Market Tech. Provides a lot more information and details, and it even live streams the companies who participate at vertical events conferences. So yeah, you guys are lucky enough to be here in person, and that's great. But when you're not, and we're holding a show in Fremantle or Sydney, and you've got investments in those companies, you can go onto their trading platform, and Market Tech will be live streaming their presentation at our conference anywhere around Australia. Then we've got our other supporters, Intlang and obviously RIU. So without any further ado, I'll pass the microphone over to the great Christina Morrissey, and we look forward to another great day at the TechKnow Invest Roadshow Melbourne leg. Thank you.
Thank you very much, Jaxon. Lovely to see you all here today. I am really excited about this conference. It's my favourite one on our entire rota of conferences, because I'm always inspired once the end of the day comes and I look back at all these amazing innovations that Aussies are involved in. And it inspires me so much that actually last year I turned around with a mate of mine who's an investment broker, and we co-founded a new TV show that went to Channel 9 this year called Innovation Nation, which is all about celebrating great Australians and their innovations. That's one way of connecting the stories to people. This conference that we have here each year, we connect you with these stories and also with the potential to invest in them. So who knows, you could be part of the next maybe ResApp. Where's that man? Where are you? There he is. There's that serial tech entrepreneur at the back there. We'll have a chat with him a little bit later on, biotech entrepreneur. We've got some really amazing Australians who do some amazing things, not just here, but create things that go out throughout the world. And I'd love to see if you think that they're worthwhile investing in today and hear your feedback. Chris up the back there. Chris, can you stick your hand up just for a second? You just heard Jaxon talk about Market Tech. This is the man behind that little bit of tech at the back too. And one of the things here today, of course, is, and I know that we have people who listen online to our conferences, is this is the opportunity for you to get in there and speak to our presenters, speak to some of these people who are behind these innovations and look a little bit more in depth. One of the most intriguing bits of innovation that we've got to share with you today, and I'm not going to tell you which one it is, but it has to do with pregnant cows. How is a pregnant cow going to make your life better? How's it going to make your next holiday the best holiday in the world, trouble-free? We'll find out about that a little bit later on today. We're going to start our program today, though, with knowledge, because knowledge is a really important thing, as we all know, when it comes to investing. And to do that, we've enlisted the help of the fabulous people at Novus. Naveed, would you like to come up here, sir? And I've actually got a microphone over there. Knowing as I do how Naveed likes to roam around the stage when he has a chat with us up here. So this is our keynote speaker, Naveed Hussain from Novus Capital. Can you make him welcome? So Naveed is going to dive into where we are in the economic cycle in terms of the technology sector, how we analyse technology shares, and most importantly, how we pick the winners from what we're going to be seeing today. Thank you.
Hello. Thank you everyone for coming to today's seminar. Thank you Vertical Events for organizing this one. It's a fabulous one, and the Links advisor to put me on the spotlight to present this on this day. I hope this presentation will be informative for you. I started my career in academia and then moved into investment banking. So I have the blend of both knowledge in academia and investment banking. So it was a very painful transition, good learning experience, and I'd like to share that with you. I'll start with a disclaimer from Novus Capital and start with this quote from Benjamin Graham. Benjamin Graham was the father of investment. He's known as the father of investment, and he is the teacher of Warren Buffett. And he made a substantial amount of wealth in investing. So what he said was that, he said that to market always anticipate what's gonna happen. So if you want to pick a winner, you have to see, you have to look at the companies and see what's the company's growth is. And then you have to see if they can achieve that growth. And then you have to see that it has market discounted that growth. So that's a key factor. One is that you have to know that the company has a growth story with them, and they have a significant path towards the growth. And the second is that the market hasn't realized that growth. And the third thing is that if they haven't, the company can realize that growth and the market has not discounted that growth. So that's the two factors in it. So to understand this, you have to go start with the economy. Where are we in the economic cycle? And how is the technology fitting that economic cycle? And when you understand the economy, the first thing you need to know is that the economy is based on two things: inflation, and if there is inflation, there is interest rates. And if interest rate goes up, usually the stock market goes up because there is a growth in it. And if inflation, and if interest rate comes down, usually the stock market comes down as well. The reason is because the market market is anticipating something. So market anticipate there's a recession going forward, or there's an economic decline going forward. But that things have changed during the COVID time. What happens when the COVID happens is that the interest rate, the government, the Reserve Bank and the Federal Reserve, they drop the interest rate to zero. And then they stimulate the economy by fiscal policies. So the two things brought so much liquidity in the market that created a massive liquidity. And there was a demand and supply imbalance as well because of supply change. So that led to a bull market after COVID. And you saw that bull market in lithium stocks. So that bull market basically happens because of fiscal policies and zero interest rates. And when the inflation, and that leads to inflation. And when you had inflation, then the Reserve Bank started increasing the interest rate. They started communicating the market that they will increase the interest rate. And when the interest rate started to go up, market anticipated that. And when the interest rate started to go up, the investors panicked because they think that interest rate would affect the economy. And that led to a decline in the stock market. And there was an extreme pessimism in the stock market in 2021, and it leads to 2022, 22 and 23. Then what happened? Then AI came on. So then there was a turning point. That's the AI revolution. That AI completely changed the dynamics of the market. And that AI has, because it affected across the industries, and it revolutionized basically how the customers, business operations, customers experience, and data analysis. So across the boards, companies can see AI can reduce the cost for the companies and streamline the businesses more efficiently. So that stimulated the market, and that created a hype in the market, and that's how the market rallied. Just like in 1995, when the internet first came into the picture. And Naveed became one of the top most valuable companies in the world. And all the tech companies in America did really well. So that has a trickle-down effect. And I believe that in Australia, you will see the tech companies start doing well as well, because that technology revolution will affect the companies here as well. So and now in the next year, you will see most of the companies are implementing some sort of AI in the business. So even during the high interest rate, market did well last year, top companies. So now going forward, the inflation was curtailed, and that inflation curtail leads to a Reserve Bank signaling that they will cut interest rate going forward, Federal Reserve. So they expect the interest rates to come down next year, come down in September. So that will create more stimulus in the market, more liquidity in the market, and that is good for the tech sector. And that is really good for the stock market, especially for mid-cap and small-cap companies and micro companies. The more money will come in. The biggest risk in the micro companies is liquidity. So when the interest rates comes down, and hopefully with the AI revolution, you will find more liquidity in the market. Now, once you know the tech sector is going to do well, because the liquidity is coming to the market, interest rates have peaked, the AI revolution is going to transform the companies. There is a more risk appetite by the investors. So how do we analyze the companies? That's the key part. And one of the key part is that look at the quality of management. That is paramount. And the quality of management can basically lead the companies to a next level. I have lost most of my money in the practical because of the quality of management. If the management is not competent, how good the companies are, eventually you lose money. They will not be able to deliver it. So when the tech conferences are the really good platform to understand the management, their path towards growth, and then understand, are they going to deliver that growth? And then realize that, is the market going to know that growth is there? Can you see the market realizing that they can deliver the growth? And if they're not, that's a very good area to invest. So the quality of management is extremely important. The second is that quality of assets. In technology companies, the asset is their IP. It's the work they have done. In biotech, the trials they've done in phase 1, phase 2. You can see from the management how confident they are with the IP, how confident they are with the quality of assets. And if the quality of assets is good, then the revenue will flow in. The revenue will come. And how the revenue will come? Because if the quality of assets is good, then you can see, can they use the platform? Can they use the assets to scale the business? And if they scale the business, is the revenue going to be recurring revenues? And if there's recurring revenues, then the quality of revenue is considered good. Because you want the companies to grow, and if the recurring revenues are coming up, then you can see the growth in those companies. And then when you look at the technology area, you look at how disruptive would it be to the existing business. When the internet comes in, when the internet started, you have master hit with all these newspapers. They're gone. You have Seek.com, you have realestate.com, you have carsales.com. So all these, they've changed the dynamics of the business. So see how AI, how the technology will disrupt the business going forward. Like you had in 90, when the technology boom happened, you never had Facebook before or Netflix. They have completely changed the dynamics. So see how disruptive that would be. So that's the most important thing, and this conference will help you to do that. Now, how do we add value as an advisor? What we do is that we basically, because the capital is limited, so the capital should go to the best investments. And that's how you optimize your capital, and that's how you optimize your return. So we look at how we can optimize the of your capital, investors' capital, by allocating to the best investments. And to do that, as we come back to the same source, that is the quality of management, how good they are, how much skin they have in the game, how much investment they have done in the same company, and how passionate they are, and what's the vision, and what's the path to that goal. How would they able to, over a period of time, deliver that thing? If they start delivering it, you can see the share price going up as well. Listen to the growth story and see what's the milestone for that. That is really key. And then you have to do the due diligence. That is, you have to look at balance sheet, profit and loss statement, and see there's no any off-balance sheet financing, or there's no any areas that is concerned for that. Look at the debt of the companies, because that's very critical as well, because debt can destroy the business as well. So that's where we come in, and through that we raise capital for 4 of those companies. Control Bionics is here. Listen to the stories. The Carmaco, we liked it because of the management. They were really good. Pointera is a technology company. They might come next year. So these are the transactions we did in the last, in this year. So, and I will end, thank you very much for coming, and I can end with this quote. I started with Benjamin Graham, and I'll end the quote with Mark Zuckerberg. He said that the biggest risk of all is not taking one at all. So that's where you're here. So look at it and invest in the company. So that's all I can say to you. Thank you very much.
That's brilliant. Thank you. That's all we can say to us. Now you do need to give us back the clicker, though. Minor technical detail. We're good at... No, this one. There you go. Thank you. Thanks, Naveed. Would you put your hands together again for Naveed Hussain, everyone? A great way to start off our morning with a bit of education. Any of you remember the name Timothy Leary at all? Remember Timothy Leary? Yeah, I just want you to think about that one for a moment. I've got one little point I wanted to point out to you. Can you have a quick look? Sorry, James, I'm taking you all around the world like a proverbial. When Jaxon got up, he talked to us about Marketech, and I mentioned Chris Hill and said you should go and have a chat with him. There's a little QR code, and see this one up here. Now, if you can pop your phones up to that, there is a competition to register for today, and there is a pair of really impressive bone-conducting headphones that you can win. They're valued at $250. You do need to be in the room at the end of the day. There's a bit of a carrot and stick approach here to win them, but nevertheless, they're fantastic. So you'll be here at the end of the day anyway. We've got a fantastic panel, and we'll be discussing a little bit more about investing in this sector with some of the great minds and some of the people that you've heard from today. And I think, again, Jaxon mentioned Toby and Brian Lieb and Naveed will be back on stage as well. So you do that, and while we're listening to our next presenter. Now back to Timothy Leary. You remember who Timothy Leary was? That great psychologist from Harvard back in the 60s, who it was a famous tune, was tune out and drop in and tune out. There was, I can't remember what it was, I need to take. But he was very active in the world of psychotropics and psilocybin and those sorts of things, and that hippie culture. Now, in my apartment building in the 90s, I actually met one of his associate professors who was involved in all of the experiments that he was doing using magic mushrooms and these different psilocybins and psilocin to see what effect it had on the mind and if it could improve us as a race of people before the American government went, no, that's naughty. We're taking this legal substance, we're going to make it illegal. That was back in the mid-60s. I give you that as a bit of a background because our first speaker up today, our first company for your consideration, could be a bit challenging when you think, is this? You know, so we want to see if we can change your mind today about tryptamine. This is Tryptamine Therapeutics. And this amazing human being here, Jason, is going to have a chat with you. Jason Carroll. So this is actually one of the newest companies that is presenting here. The company itself has been around for a while, but newly minted on the ASX. So this is your opportunity to get on the ground floor and invest. I think you'll find this story very, very interesting, and I'm sure it's going to prompt you to go back and have a look at the whole sort of story behind Timothy Leary, etc., and see. Should I get off the stage and let you hear him? Yeah, I should, sorry. Would you please make Jason very welcome, everyone?
Thank you very much. Look, I'm not under any false impressions of how people view psychedelic medicines. And I'm certainly not here to indoctrinate you through any wild epiphanies undertaken in some tent in South America. I'm not going to do that. Look, until last year, my whole career has been dedicated to big pharma and the big pharma empire. That's why I have the coat, see. So for 34 years, any anecdotal evidence of psychedelic efficacy to me was nothing more than a bunch of hippies talking about placebo effects. So I'm a scientist through and through, organic chemist, and it's to my core, but I spent the last 30 years working in commercial because I know you need to link the science with the commerce, otherwise you fail. So it's very, very important to do that. I've worked in commercials at 30 years. I got to be one of the top 200 executives at J&J, one of only 6 managing directors that actually managed all 5 Johnson & Johnson companies in one country. That was in Vietnam. So 1,000 people, I didn't speak Vietnamese, and 5 J&J companies coming in. So 120,000 employees. So it was nice to get there, but then once you get there, you wonder what else is there. And look, from a point of view of what I saw when I saw, as it was called then, Therapeutics, now Tryptamine, I saw data that I'd never, ever seen before in 30 years. And I've worked in business development, license acquisition. $100 million to $10 billion companies were purchased in that time. And I have never seen data like I've seen here. So from a point of view, and I'll show you this while I talk, because I think that way you can read all about it. Pharmaceutical medicines really live, breathe, and grow based on 4 critical elements. You've got to have safety. You've got to be safe, otherwise you're never going to get off phase 1. You've got to have a target disease population. You have to know where you want to put this product that you have, otherwise you have nothing. You've got to have efficacy. The thing has to work. If you can work better than what's out there at the moment, then that's even better. But phase 2 and 3, you work on your efficacy. The 4th is you've got to have time. Time to be able to build that product into a successful one. So you need IP, you need patent. And that way you have that runway to build that product as you want it to be. If you don't have all of these, then you have none. You might as well not even bother getting out of bed. Show me the data that a product has to clinically provide a meaningful advantage in safety and efficacy in an unmet clinical need. And it has the benefit of time through protection that you put around that product. And I'll show you the money. Please keep an open mind for the next 10 minutes. I'll show you the reason why I joined this company, and I hope that some of you will be thinking similarly when we get through this. I'll also show you why I believe that psilocybin, and more importantly, the active ingredient in psilocybin, which is psilocin, will be the most important rediscovery in neuropsychiatry for the last 50 years. And I'll show you that now. For those of you that know much about psychedelics, there are about 350 studies underway right now. 133 of those are with psilocybin itself. Now, for those that know, psilocybin comes from a psilocybe mushroom. People often will take that mushroom or they'll synthesize the same ingredient and they'll give it to you in a capsule. That tends to be what they call the gold standard of treatment. It's the best psychedelic. It's a very inward experience for those people that take it, so they don't talk much, so you don't really get much from them. But when they come out of that experience, we call a neuroplastic experience, rewiring of the brain. And when I grew up, I was told what you have in your head is all you're going to have. Never have anything else. And then I start seeing that neurons can regrow. And these things I never thought were possible. So from a point of view of oral psilocybin that you'll see here behind us, you need about 10 hours for that treatment to work. And that's because it's a capsule. You have to metabolize it through your liver. It then pulls out the psilocin. Psilocin goes to your brain. neuroplasticity occurs, and then over time you come out of that. Now, as a patient, I'm sure it's pretty boring. But from a clinician's perspective, dead boring. And we have feedback even from physicians who do clinical studies for 8 to 10 hours. And it's like watching the paint dry. And you've got psychiatrists and you've got psychotherapists in this country, and they see so many patients, and their time is so important that having them wait a whole day for a response for one patient is really tough. Onset of that state, to get that neuroplasticity to occur, 1 to 2 hours, more 2 plus. 1 hour is pretty much an exception. So imagine if you can give someone a treatment, and in this case, the active ingredient in psilocybin through the best possible route of administration, which is IV infusion, over a 2-hour period. So you can keep them in that state that you need them in to undergo that change they require, and after 2 hours, you stop them. So instead of 10 hours, you're looking at 2. Think about the time that is saved and the money that is saved. And think about the patient who doesn't have to wait 2 hours to even start. In 2 hours, it's done. So the time is very important. Precision targeting of blood levels of psilocin itself, free psilocin. No one knows what these patients are getting. So they just don't know. So it takes such a long time. There's a 4-fold difference from those who got the least amount of treatment and those that got the most. 30% of everyone that takes a standard 25 milligram psilocybin capsule will not get anything happen to them at all. And they'll go away saying, what was all that about? That was a waste of time. 3 in 10. So you get people it doesn't work with, you get such a long period of time, you cannot reverse a capsule. You can speed up, slow down, and stop, and infusion. So the psychiatrist and the therapist have control over that process. They can decide what that patient needs. Otherwise, they don't know. They're sitting there for the ride like the patient is. They don't know what to expect. But IP positioning is really, truly important. You cannot have IP around a psilocybin capsule. Psilocybin is a naturally occurring product. You cannot patent what's in nature. So you have to make nature better, if that's possible. So if you can take away the metabolism, therefore you have a much more even distribution in every patient that you treat. You give them a pure product, so your regulatory authorities around the world won't say, what's inside that psilocybin? Well, there's about 400 different molecules inside psilocybin. What's inside that psilocin? Psilocin. USP quality. Synthesized in a laboratory. Oh, great. That's what the regulatory authorities, TGA, EMA, FDA, that's what they look for. And then they need data. I was at a presentation earlier last week with the head of the TGA. We're talking about psychedelic medicines. And it's like so many people were saying, why aren't these approved? Why aren't these approved? It's like, well, how does the TGA approve a mushroom? How can they? They need data. They're waiting for it. And I can tell you something. They're going to get it. That data, they're going to get it because we are going to deliver that data. And is it commercially scalable? Is it scalable to put someone in a room for 10 hours with 2 people all day long? $10,000 in labour alone, not to mention the cost of the product. Who's going to afford that? Government? The individual? No wonder only 19 patients have been treated in Australia in the last 1 year. Now, I'm not going to talk too much on this one. I'm going to go basically to this one right here. Much easier, right? This is 22 patients, or 22 subjects, I should say, but who knows, they're probably patients as well, that took 1 capsule of psilocybin. And this is how long it took to work, and these are the individual patient readings of psilocin in their blood. I've mentioned there's 2 points there around therapeutic zone, where we believe people get the best effect. There's a low point, which is about 10 nanograms per mil of psilocin, very, very small quantities. And there's an upper point about 30. But most people stay within a range. If you look here, you'll see 6 people that didn't even get to a range that would be considered to be effective. And if you add time bars in there as well, after 1 hour, one patient or subject started to feel something. After 2 hours, 13 or 14. Some got more than others. Some were up at the upper end, nausea. The good thing about psilocybin in this particular case, it's neither addictive but it's also safe. So non-addictive and safe, not to mention the fact that if you do go too high, you have a little traumatic experience. So keeping them within a range is an important thing to do with something like psilocybin. So imagine the opportunity that we have at Tryptamine to be the company that can deliver exactly what the patient needs over a 2-hour period. No one else can do this. And if you're looking at intellectual property protection, Tryptamine Therapeutics has IP around the use of an IV infusion for psilocin and for psilocybin. No one else in the world can use this. We have it. We also have IP around the crystalline structure of psilocin, because psilocin itself, there's a reason why psilocybin is in nature and psilocin is not. Because psilocin lasts 1 day on its own. It needs something around it to survive. So we put a crystalline salt with it, so it will be shelf stable for 5 years. We have that. We have IP around that, plus other salts that can also be used to do that, to stop other competitors coming in and trying to do what we're already doing. One thing I know, I've only got 3 minutes, I'll get through as much of this as I can, but I have a presentation, also on our ASX website, we have this presentation in full, people want to read it, but I have 50 of them with me, so if you need one copy, I can give it to you. The other thing that's important, I'll talk about IP, because I think that is extremely important, is there are 3 conditions that we are working in. Binge eating disorder, okay, fibromyalgia, which is pain all over the body, actually stemming from the brain. 20 years ago, doctors didn't know how to treat them with fibromyalgia. They would say, I can't find any pain, you didn't hurt yourself, I can't find anything. And they would just send the patient away, saying it's all in your head. Now, unfortunately, they're actually correct. It is all in their head, but the pain is real. The body makes that real, because everything we have, everything we touch, if we have high sensitivity, touch a hot plate, it's not hot in that physical sense, but the brain says, don't touch that. So if you go through a trauma and you've injured yourself in a terrible way, it could be years before, your brain tries to save you from being hurt. So it says, don't do that because you're going to be in pain. So it creates that pain for you to protect you. But unfortunately, when it does that every single day for years, it's extremely traumatic. And there are no ways to treat this effectively. Antidepressants, almost everyone with fibromyalgia is antidepressant, doesn't work. Pregabalin or Lyrica, it's on the PBS. You can use it for fibromyalgia, but within 1 year, 95% of people have stopped taking it because its side effect profile is disastrous. This is a disruptive technology in those areas. The third one is irritable bowel syndrome. Now people say, what about IBS? How can this possibly work in IBS? It's a psychedelic, for crying out loud. There's a huge gut-brain interaction with IBS. You have 10% of serotonin in your head and you have 90% of it in your gut. We believe that we can also stop chronic pain associated with IBS. These conditions affect 100 million people around the world. 4 million of them right here in Australia. All of them have no effective treatment. And we have IP around every one of those indications globally. Anyone with IBS, fibromyalgia, or binge eating disorder, it's our territory. We have a $20 million valuation. We listed 8 weeks ago. You guys can do the math. This is why I joined. And before I know I get kicked off, I would like to show you one thing. Binge eating disorder. One slide only, if I can, indulge me. 6 patients, we actually had 12 we planned to do. We hoped to get a 50% response. 6 patients responded, 6 didn't. In this case, the study was stopped at 6 because we had 6 patients responding. And no matter how many binge eating or disorder episodes they had, or how much they craved to eat, whether it was every day, whether it was twice a week, they all dropped 80% in terms of their desire to eat and their actual episodes themselves. All dropped at the same level, all of them, and maintained that durability for almost 3 months. These people would be on 360 tablets in that time versus one treatment. In this case with psilocybin, can you imagine what happens when they have IV psilocin? That's why I joined, and that's why this is disruptive, and that's why I'm going to make you some money. Thank you.
Thanks, Jason. It's a really interesting story. We were doing some research for Innovation Nation last year and talking with Jason, some other companies as well, and insurers are really interested in this because it's the sort of thing that will save them thousands of dollars. So maybe Big Pharma isn't interested, but insurers are, and if it's saving them money and saving us as people as well, it'd be an absolutely amazing development. But remember, always apply those things that Naveed told us at the start of the day with our investing. Charles Slack was the name of that professor that I was talking about that I met at my apartment building. He was in his 80s back then, and he was really, he told me the stories of these experiments with Timothy Leary and said how disappointed and distressed he was when the government took that right away from them to try and help people because they really believed it could help to heal. So I think it's pretty interesting now that we've come all those years down the track and there may well be something in it the government finally thinks. Look at this fellow here holding his morning coffee. Is that a good Melbourne coffee you've got there? Barista made? Fabulous. This is Gary Phillips, everyone. He's the CEO of Syntara. Now, Syntara is focused on blood cancers. They have one drug in phase 2. They have 4 trials underway. Really impressive results. And to talk us through what they are achieving, would you please make Gary very welcome?
Thank you. I'm sipping on my coffee because my voice is suffering from a bit of flu I had last week, so bear with me. Syntara, I'm not going to try in 15 minutes to explain all the science behind the company. I'm going to give you the reasons why I think as an investor you should look at us and think about the triggers for making an investment in a biotech company at the stage that we're at. So we are a clinical stage drug development company. So we're not at the stage where we've got drugs curing rats and mice. We've got drugs in the clinic treating patients as we speak. The things that distinguish Syntara from the other competition and peer group around us, we have our own laboratories. I have biologists and chemists working on our own IP. So all the drugs we have in the clinic come from our own invention. They're not licensed in from universities or other companies. They're not repurposed other things before. They're things that we've produced ourselves, and they've got long patent lives. So they're all built around composition of matter, the strongest IP you can get, and most of them head out to patent protection until late 2030s. That IP platform is very well validated. Our science has been collaborated with investigators and researchers globally, and we've published several publications in Nature publication, which is a publication which is the highest impact science journal in the world. So if you get your science there, you know that it's really been peer reviewed and really gone over with a fine-tooth comb. We have a really experienced board and management. I think one of the things that you need to look at is who are the people behind the company managing it on your behalf. And last but not least, who are the other investors? And the other distinguishing thing about Syntara, when I show you the share chart, is that 60% of our shares are held by specialist healthcare institutions. Now, you won't see any other companies, probably not in the sort of $500 million to $1 billion market cap with that kind of institutional backing. And half of those institutional backers are insiders in that they've already invested in technologies and made considerable amount of money in diseases which we're studying. So they've come to us because of the disease area we're in, and they've come to us knowledgeable about what is the hurdle to get over in order to make money. Our lead asset is in blood cancers, 2 different diseases, myelofibrosis, which is fibrosis of the bone marrow, and the other one, myelodysplastic syndrome, another kind of blood cancer. That study in myelofibrosis, as of this morning, I was a bit late getting here this morning because I was finishing off the press release, is fully recruited. So we're now on track to deliver data by December, with the final data coming out in the middle of next year, discussions with the FDA at the beginning of next year. So this is a company and a drug which is on its way. Studies not recruiting, it's fully recruited. An investment in Syntara is not a one-shot on goal either. So we're not a company where your investment is reliant on one drug, one clinical trial, a binary event where you can lose everything or gain everything. We have a pipeline of drugs in skin scarring and in neurodegenerative diseases like Parkinson's as well. Those studies are also in phase 2, also recruiting, and will deliver data by the end of 2025. So this is a company with a pipeline which is delivering assets through. The areas that we're in are of extremely strong interest. So the myelofibrosis I mentioned to you earlier, I'll talk a little bit about the value of companies that have exited in this area in the last 3 years. And over the other thing that's going to drive your potential investment is news flow. I've just told you about the news flow this morning. You're the first to hear it. It will be live in about 10 minutes. The other news flow that will come is strong, driven by all those phase 2 clinical trials, recruiting and then delivering data over the next 6 to 18 months. So those shareholders, at the bottom right of this slide, DNA Income, a UK fund. We raised money in December last year. They went from 12 to 20% shareholding, having spoken to several professors of hematology globally before they did it. Platinum Investment Manager, Bianca Ogden is the fund manager there, based in Sydney. She's a bellwether, a key opinion leader in healthcare investment in Australia. She went from 8% up to 17% in the raise we did in December. BVF Partners, an West Coast US specialist fund, billions of dollars under investment. They've only invested in 2 or 3 Australian companies. You might remember Viralytics, Opthea. They were in and made a lot of money in those companies. So again, a really, really good register. These are the people that have invested their money because they know us, they like our science. BVF have been with us since 2015, DNA Income since 2010, and Platinum since 2018. Looking at the share price on the right-hand side, on the left-hand side as you're looking at it. So just to explain why I think this is a unique opportunity. We raised money at 2.2 cents in December. We had one fund where our stock, they were a 10% holder. The stock was the last stock in a fund which had closed, so they could not follow their money. They had to exit. They exited in January, very messily. Not a great idea selling your ASX stocks in January when everybody's on holiday. They exited at 1.5 cents. Some of that stock went to sticky hands, long-term investors. A lot of it went to traders. So for the next 3 months, we drifted along with every bit of volume we got, people taking profit. And then we burnt through that. And then we started really accelerating with the stock price going up as we had more buyers and sellers, and we're on our way there now. Now, we did do another small raise yesterday, $5 million. We did that to support our cash position, which is now looking very healthy at a pro forma 13 million. That cash takes us through to the middle of 2025. We had to do the small raise yesterday because we had a company that we'd sold part of our business to owe us $5 million. And it looked like the timing and volume of that coming back to us was uncertain. So hence we had to go back. It was a small raise done tightly amongst the top investors to get us there, but that was done at 2.8 cents yesterday. So that's why the share price dropped yesterday. This is an opportunity and a price that will rise on the back of data that comes from those studies in a run-up to that. The board. Our chair is Kathleen Metters. Kathleen was the head of global basic research at Merck. She had a budget in the billions, thousands of staff. She's a rock star in biotech terms, and we were the first company that she joined after she left. First Merck and then a US biotech company called Lycera, which exited very strongly to another biotech. Simon Green was the head of plasma research here in Melbourne at CSL. Had a 20-year stellar career with CSL. Myself and then Hussain De Silva, also a key opinion leader and analyst of great repute in the healthcare stakes. who backs the companies that he supports. He was also an investor in the round yesterday that we did. Now, our science, we are an anti-fibrotic drug that deals with fibrosis. If you cut yourself, your body floods the cut area with collagen fibers, protein strands, and then you have an enzyme called lysoloxidase which cross-links the collagen and causes it to form a tough, thick scar tissue. You'll see the scar tissue in your skin. The same thing happens in any organ that you damage. So liver fibrosis, kidney fibrosis, cardiac fibrosis, bone marrow fibrosis I'll talk about. That fibrotic tissue is non-functional. It doesn't work. So if you have liver fibrosis, your liver doesn't function as well as a normal liver with no fibrosis. You can take the analogy, if you went to Bunnings and bought yourself some fiberglass. For any of you who've mended a hole in your speedboat or your car or countertop with fiberglass, you buy the fiberglass mesh, which is all loose and loose weave. You buy a hardener, you add it to it, and it forms a hard, tough skin. Same thing happens with our fibrotic process in the body. The collagen is the loose weave mesh. The lysoloxidase is the hardener. We have a drug which inhibits the lysoloxidase enzyme fully with 2 tablets twice a day, with 1 tablet twice a day. So this is a really effective drug that does stop fibrosis. In every model we've run, we've always showed that the drug is antifibrotic. We've published extensively in Nature, and we're now in a trial with myelofibrosis. Myelofibrosis is a disease which has a life expectancy of 5 years. It's an orphan disease. Our drug has got orphan designation from the FDA, as well as an IND. Myelofibrosis is a fibrosis of the bone marrow. Your bone marrow is your body's blood production unit. So it produces red cells, white cells, and platelets. If your bone marrow becomes fibrotic, it doesn't do that. You get lots of side effects, symptoms, enlarged spleen, bone pain, night sweats, and you die after 5 years. The only drug at the moment which is used are drugs called JAK inhibitors. JAK inhibitors treat these diseases symptomatically, so they reduce the spleen size, they improve symptoms. They do not improve life expectancy. They do not reduce the amount of fibrosis in the bone marrow. Our drug is potentially disease modifying. We can show that we reduce the amount of fibrosis in the bone marrow, and patients that we've treated in a study where these patients had failed on the JAK inhibitor, so only had 1 year of life left, we demonstrated that they had not only improved fibrosis in their bone marrow, so reduced amounts of fibrosis, we also showed that their red cells and platelets were either stabilized or improved, and that their symptom scores went down. The drug is also shown to be already in patients at this end of life stage to be safe. So in that study, which we reported at the American Society of Hematology in December last year, we saw no serious adverse drug events and no dropouts because of the drug. So this is unusual. A lot of other drugs in this area that are trying to be developed have quite nasty side effect profiles. So the ability of our drug to be added on to the standard of care looks like a really attractive one to clinicians. We took that data back to the FDA in Q3 last year and showed them the safety data, we showed them the efficacy data, and they said, we're happy for you to go ahead. The study we started in December was the recruitment of patients who were already on a JAK inhibitor. So this is now the whole of the group of patients with myelofibrosis. We aimed for 15 patients. We recruited and dosed the 15th patient yesterday. We're aiming to show in this 12-month study that we can reduce fibrosis, improve symptoms, reduce spleen size, and importantly, improve their blood counts as well. This is an open label study. So we will have interim data reported at the American Society of Hematology in December this year. So if I know anything about biotech stocks, you will see the price start to appreciate as people start to get involved and see the results coming in the December. Now, it's not one of those endpoints that's going to flex either. It's open label. I see the data as it come in. We already see that the safety profile of the drug in combination with the JAK inhibitor is equally as good as it was as monotherapy in the earlier study. I think we've ticked that box. We're now waiting to see what the efficacy is. And we will put all the data we've got up at ASH in the beginning of December this year, later this year. So we're really excited about that. With that data, we will go back to the FDA in Q1 to discuss the pivotal study, the registration study. And I expect that the data from the study, plus the response we get from the FDA, will attract interest from potential partners. And the decision for the company in the middle of 25 will be raise more money to do the phase 3 study, or go ahead and partner the drug at that point. Now, if we choose to partner, this is the example of the kind of deals that have been done in this space. This is 3 companies that have exited in the last 3 years with a drug with phase 3 data. So that raising money to do the phase 3 study, the prize at the end of that is approaching $2 billion. The company in the middle there, CTI, had phase 3 data. They got an approved drug, sold themselves to Sobi for $1.7 billion. 2 of our institutional investors were backers of CTI, and they're now investors in us. I mentioned at the beginning that we're not a one-shot on goal. I've talked a lot about 5505, our lead drug in myelofibrosis. We have 2 studies in myelodysplastic syndrome starting up in the next 6 months. Both of them are funded with government grants, so non-dilutive funding coming into the benefit of Syntara shareholders. One of them is an Australian study, the other one's going to be done in Germany. Huge commercial opportunity there as well. Very excited to see those studies start to go. We've got a whole program in scar prevention on the skin, which has been done with Fiona Wood, which some of you may know, a professor over in Perth. She's already done phase 2 studies showing that you can reduce scars on skin by applying our drugs as a topical cream. We've got one study already running with her and another one we're about to start looking at whether you can reduce scarring or stop scars forming after surgery. A huge commercial opportunity there. And last but not least, a study that's in Parkinson's disease, where we're treating patients who are at risk of Parkinson's, where we're looking to see whether we can stop neuroinflammation in their brain. That's supported by a $5 million grant from Parkinson's UK, so another bit of non-dilutive funding. So news flow, driving value, very strong for the next 6 months, lead up December, and then going on to throughout next year. Thank you very much for your attention.
Thank you very much, Gary. Imagine that you were diagnosed with cancer and the next step of your cancer journey was as simple as picking your therapy simply off a shelf. Imagine if that was possible. How would it change your cancer treatment? How would it change your journey? Our next company up on stage, their mission is to change the way that cancer is treated, making it an easier journey for people, and they are laser focused on that. I'd like to introduce you to a potential game changer, Chimeric. This is their COO. She is currently also their CEO, Dr. Rebecca McQualter. She's going to announce their CEO very soon, just not today. She is credentialed to the hilt. She is passionate and she is staying the course on finding this solution and sharing it with us. Please make her welcome.
Thank you so much for having me, and thank you, Christina, for the lovely introduction. My name's Dr. Rebecca McQualter, and it seems like everyone in the CEO speaker circuit's got the flu at the moment, so please, I apologise for this horrible sounding voice. I don't normally sound like this. But just a little bit about me really quick. I've only recently joined Chimeric and taken the reins, and I'm very proud to have inherited such great technology. I've got a PhD in cell therapy, and one in particular, one of our assets from Monash University. And I've worked for Big Pharma here in Australia and also in the US. So I'm delighted to be here today to share Chimeric's amazing story with you. Here's my disclaimer. So as I mentioned, Chimeric is a cancer cell therapy company. We have 3 amazing assets, all in phase 1. We have 4 phase 1 clinical trials running all the way across the US, and it's my job to bring them home to Australia. So I want to run you through some investment highlights, and we'll move through them a bit slowly, but we'll focus on the assets a little bit later. But as I mentioned, we've got 4 phase 1 trials running across the US, and we've treated almost 30 patients to date. So this is kind of perplexing to me because I'm new to the finance game. We've got such hot technology. We're in the clinic. We're treating people. We're working really well with the FDA. But our corporate value and our profile, we're sitting at 2 cents. We've got a tiny market cap. And I just don't understand where the value realization is. And so, because I'm new to finance, I'm going to need someone to teach me why we're so undervalued. But over the next 12 months, we'll have multiple clinical updates. So we're just about to dose our first patient with our very exciting CDH17 asset. And so just from that program alone, we'll have 3 updates to the market in the next 12 months. From our other 2 programs, we'll have a lot of news flow as well. Now, I'm the only person based here in Australia. The rest of my amazing team are all based in the US. And so I've got 5 people in the US, and they all have experience bringing cell therapy to market. We've all worked for big pharmaceutical companies that have brought a cell therapy from the clinic all the way to commercialization. And I can't tell you how many times I've seen grown adults cry over the regulatory hurdles that we have to jump through to bring these amazing therapies to market. But my chief medical officer, for example, he worked at Juno, and that was acquired not that long ago. And my head of manufacturing, who's worth his weight in gold, and one day you'll get to meet him. He's been so valuable over the last few weeks. But he used to run the global operations for Kite Gilead. So I don't know if you know that little company, that little cell therapy company, but we've got a very experienced team on board that all have significant experience with drug development, but in particular with the nuances for cell therapy. I'm really proud to stand here in front of you to say that we are the only company in the world that has the CDH17 target in a cell therapy format that's in the clinic. That's a really unique thing to say as a very small biotech from Australia, but we're really proud to be at the front of the pack for this one. Now, that particular target targets gastric cancer, pancreatic cancer, and bowel cancer. So a really huge market to tackle for that particular target. We also own a first-in-class brain cancer target for the nasty glioblastoma, and that's our chlorotoxin CAR T, and that's what the company IPO'd on a few years ago. This is beautiful technology out of the City of Hope in Los Angeles, and we're really hoping to work with Peter Mac to bring it here to Melbourne. For all of my beautiful assets, they all have a long, robust profile for their patent life. And because my team are pretty clever, we don't have to worry about our patent life because we'll be up and out of phase 2 pretty quickly. And I'll share that with you in a second. So before you leave today, I really want to make sure that you walk away saying, hey, I saw Rebecca, she's from Chimeric and she's working on cell
controls. The middle panel, you see extensive fibrosis in the mice that are treated with doxorubicin. And then the right-hand panel is the combination of bisantrene with doxorubicin, showing a marked reduction in fibrosis. So this is just a build-up of collagen. That's the gray you can see in that middle panel. So all looking very, very positive for the combination. Now, let's go back to the problem that Ledley had that led to them dropping this drug. They tried for over a decade to try and reformulate it. We've actually been hunting down and speaking to some of the people who worked on bisantrene in the past, and they just couldn't do it. We've applied newer techniques that have been developed in between time. We've got a terrific group of researchers down at the University of Wollongong who are employees of RACE, and they managed to reformulate the drug so it now is very soluble. And we've done a lot of testing now, and we can deliver it through small veins. It doesn't crystallize, but the molecule itself, once it's in solution, is exactly the same as the drug that Ledley developed back in the 70s and 80s. So we have a high degree of confidence that the clinical effects that Ledley saw will be reproduced, but in a formulation that can be readily delivered to a much, much broader range of patients, including those with solid cancer. Now, bisantrene is an old drug, so the patents expired many years ago, but we're now filing new patents on this formulation. It was quite challenging to do it, even using those modern techniques, and very challenging to make sure that the PK/PD, the way the drug behaves once it's in the body, matched the original drug. We also know now why bisantrene is cardioprotective. We haven't announced that. We haven't published it yet. We're really getting all of that data together to put it into a peer-reviewed journal, hopefully a prestigious one. You know, Big Pharma, when we're talking to them, they want to see quality data that's published, not a bunch of news releases from the company. So we can really build on the clinical experience of bisantrene, and it's very, very rare to be setting off on the clinical development of what is considered to be a new drug, knowing that your drug is active, knowing the safety profile of it, and that really reduces the risk profile of what we're doing. So this is the key study coming up. This is looking at the new formulation RC220. It's going to be an all-comer study, so any patient who's about to receive a doxorubicin-containing regimen would be eligible to come onto the study. It's a dose escalation initially so we have a dose of doxorubicin, we'll step up the dose of bisantrene in time in the dose escalation phase, and then we get into the exciting part, which is the expansion cohort, which would be 20 to 30 patients. And here we'll be measuring all of the cardiovascular issues with the drug. So looking at a range of biomarkers, but very importantly, also VO2 peak, which is a very sensitive measure of cardiovascular health. When they measured VO2 peak, even with the limited dose that's allowed these days of doxorubicin, they saw a 15% decline in overall cardiovascular fitness, and you could detect it after a single dose of doxorubicin. So this is a very, very sensitive measure, much more sensitive than measuring the output of the heart, for example. A 15% decline, that's the equivalent of aging 15 years. So after a certain age, I don't know exactly what age it is, your cardiovascular fitness drops by about 1% on average per year. So, 15%, hopefully everyone in this room is healthy. Maybe you wouldn't notice a 15% decline, but if you're a cancer patient and an elderly cancer patient, it can make the difference between being able to walk to the shops, being able to dress yourself, being able to walk up the stairs. So it is very, very significant. So at the end of this trial, we'll know that the drug is safe in combination with doxorubicin in man. So that's an important hurdle. And then we will know whether it is cardioprotective in man, and we've done a lot of work looking at models of cardioprotection. So we're very confident about that. So clinical pipeline, very quickly. We've just completed a study, we announced it yesterday. The closing out of a study in Israel using the old formulation. This was in very advanced patients with acute myeloid leukemia, 40% complete response rate. Again, remember, the drug in the blood is the same with the 220 formulation and the 110. And then the important trial is the cardioprotection and safety study for RC220. Also, as a result of those stunning results in AML, we're going to be setting up an investigator-sponsored trial in AML in Australia. The results were so compelling. The potential market is large because there's about $1.5 billion of doxorubicin sold every year at $100 a dose. Our estimates are we will be able to sell the new formulation of bisantrene for about 15,000. So that's about a 3% conversion from doxorubicin to combination. So lots of upcoming milestones. I've run out of time, so the presentation is online, but all the upcoming milestones are really driven by the clinical development, getting the IND to open up the US. And I'll just leave you with the highlights here. Thank you very much indeed for your attention.
Thank you very much, Dr. Smith. And he did very, very well, because if you look in your program, you would notice the non-deliberate mistake where I grabbed Peter up because I was so busy reading his profile and missed the fabulous Mr. Smedley, Nicholas Smedley. Now, if you've been following the Findi story, how many of you in the room were here last year? So quite a number of you. So you will have seen Nicholas present in the past before, and I'm no doubt a number of you will have been following the story with interest as well. So Findi, Nicholas's role with Findi is as a chairman, and Findi is an ASX-listed fintech company, and they offer tailored payment services through their network of ATMs and digital payment platforms in India. Now, this time last year, we were talking about the volume of transactions they make each day, around 2.7 million, which is 6% of the market there. And this year, things have only gotten better. So I'm sure you're going to be amazed by this and inspired by this next presentation. Would you please make Nicholas very welcome? And Nicholas, my most sincere apologies. Thank you.
Thank you very much. Well, it's my pleasure to be back here again, 12 months later, to give you the latest update on where Findi is trading, how we're performing and what we have ahead. As a business, we've just recently reported our FY24 financial results. We're at 31 March year end. We were very happy to report that we delivered 66.5 million in revenue for the year, 27.4 million in EBITDA, and 4 million in NPAT, which was in line with guidance, and our EBITDA exceeded there slightly. But most importantly as well, our transaction numbers continue to grow, now doing in excess of 1 billion transactions per day, or more than 2.7 million people using our service every day. And the way I look at that is every 2 days, the population of Victoria effectively uses our goods and services across both our physical ATM and now more than 34,000 digital merchant locations. So the business is in two key areas, the first of which is our ATM Solutions division, where we have 8,000 ATMs that we actually own, and then we also manage third party for BTI, which is the largest white label ATM operator in India. We manage all of their ATMs on their behalf as well, which takes our total ATMs either owned or under management to around 21,000. On top of that, we also have 34,000 digital merchant locations now across India. We're currently in 6 states and territories for those 34,000. Happily report that last month we delivered a merchant onboarding of in excess of 3,000 new merchants. And the month before that, we onboarded another 2,800. So that part of the business is accelerating very nicely after the board made a decision for further capital investment in that at the start of last year. The market opportunity that we actually have at Findi is vast. India itself is a 1.4 billion odd population, most populous population in the world. There are 350 million people out of that population that are completely unbanked. They have no digital footprint, only dealing cash. And then you go one step further up there, there's 450 million people in India that do have a bank account, but they haven't actually used it in the last 6 months. So we see the unbanked opportunity effectively being 800 million of that 1.4 billion plus population. There's also two key elements in India at the moment that really are driving our growth. Both cash is growing at more than 16% per annum in the economy, and also the percentage of cash as a payment mechanism has more than doubled over the last 5 years, going from 6% in 2016 to more than 14% in 2020 in the last census data. And we're expecting the 2024 census data to be largely in line with those same percentages, even though the economy has grown greatly. But at the same time, digital is also growing. hence the number of merchants we're onboarding on our digital Findi Pay side, which I'll go into more detail shortly. In terms of key themes that we've delivered over the period, as I've mentioned, we've got a robust market opportunity. We've got diversified operations. We're in every state and territory across India. We're the only payments and ATM business in India that is pan-India, truly national. We have a great growth strategy, both organically and inorganically, which I'll talk about. We've got 4,000 ATMs that we'll be deploying organically ourselves this year. And then we also have a number of highly advanced acquisitions that I've told the market about that I'll be hoping to announce in the coming quarter. And then we also have a significant pipeline of new contract or business development for our brown label ATM business. And as I mentioned yesterday, we're in the final stages of tendering for a significant contract at the moment with last weekend tender documents going in, and we're expecting results to be within the next month. As said, we have a leading scale position with the largest operator of ATMs across India. We have a fantastic customer base. As said, more than 2.7 million people using us on a daily basis and growing. And we have a fantastic management team in India. And I'll go on to the next slide. In terms of our re-rate potential, our listed peers at the moment on Australia are trading at close to 13 times historic EBITDA. We're currently trading at 5.4 times historic EBITDA multiples. But our listed peers in India are trading at in excess of 20 to 30 times historic EBITDA. And the reason why I mention that, we delivered some milestones in the last 12 months, which have put in motion our listing timetable for our subsidiary in India. We're targeting second half of 26 calendar year to be listing our Indian subsidiary. And that's why when you look at our listed peers in India, that would imply on the numbers we have just announced historically for FY24, a market cap of 500 to 800 million equivalent. And we will be putting out market guidance tomorrow for the full financial year FY25. So that'll be at 11 o'clock tomorrow. Key milestones that we delivered. We have a new 10-year contract that we delivered with SBI. That's 7+3. That will deliver more than $620 million in revenue over that contract period and deliver about 230+ million in EBITDA. We also had a significant investment from Pyramid Alternative Investments. That valued the company at the time at $190 million. If that deal was now done on the numbers we have just delivered, that would value the business at $270 million. Most importantly, that gave $37 million. We also had options convert in the business in January. We had a large number of listed options that have now converted and no longer exist. That delivered just over $10 million of capital. So we've delivered $48 million of capital for the year. As stated, we secured the new SBI contract. We raised $48 million to drive growth. We also, importantly, in April of last year, secured our provisional ATM license, white label ATM license in India. And I can state that we're on track for lodging in the month of August, our final stage of that, meaning that for the second half of this financial year, so from October onwards, we will be deploying our own white label ATMs, which will add in excess of $25 million of revenue and $7 to $9 million of EBITDA on an annualized basis. We also have a significant opportunity on the Findi Pay side of our business. So as it stands at the moment, Findi Pay, as I mentioned, we have 34,000 locations across India. We've told the market that the aspiration by the end of this financial year, being 31 March 2025, that we'll have in excess of 60,000 locations across India. And given the growth rate at now in excess of more than 3,000 a month, that number should be easily obtained. At the moment, we sell 7 products and services effectively through those merchant locations. It's money transfer, electronic bill payment, mobile phone recharge that we go through and do. Also local bus and train travel that we go through and do. But we're very advanced in partnership discussions with some of the banks that we do ATM services for. And what that will mean for us is we'll go from having 7 key products that we currently sell through that network to having an additional 35 products that we sell through that network, taking our product portfolio to 42 products. And most importantly, with that partnership, there'll also be guaranteed minimum revenues that come from that partnership per location that we roll out. So that's in a very exciting position for us to be in, and I hope to be announcing more about that in the coming month or so. Just briefly, the historical numbers that we delivered, we were very happy. Total revenue was up 22% compared to 23. EBITDA was up 63% on the prior year. NPAT was also up a similar number, but off a very low base. And operational cash flows were also performed very strongly. We told the market that we would deliver 20 million of operating cash flow. We delivered just over 26 million, and that was versus 4.7 million of the prior year. As said, guidance will be coming out tomorrow at 11 a.m. for FY25, for which we are very, very happy and looking forward to announcing tomorrow. The main thing as well for the business, we're in a great position financially. We've got 106 odd million dollars of cash on the balance sheet as of the March 31 of this year just gone. That completely funds all of our growth objectives. So the new SBI contract that we won last year is fully funded. The acquisitions that I have spoken about, the first two of which are fully funded as well with this number. So we're in a great position to drive growth for FY25 and 26 and beyond. As I've said, we have the traditional brown label part of the ATM business, as well as our white label ATM, which will be rolling out in the second half of this year. One element that I haven't spoken about is the interchange fee. If you do some Googling at the moment about the interchange fee in India, you'll see a lot of media reports that there is speculation that the Reserve Bank of India are looking to increase that again. They increased it 2 years ago. Now that we have our white label license, we're actually part of those panel discussions with the government in relation to what they're intending to do. We have a slightly more conservative estimate out there at the moment. The media reports state that that interchange fee will increase from 20 to 21 to 23 from 17 rupees per transaction. We believe it'll be at the lower end of the range, going from 17 to 19, whereas 2 years ago they went from 15 to 17. So we think it'll be a 2 rupee increment. 2 rupees on an annualized basis to our existing business adds about $10 million to our bottom line. So even at the bottom end of that range, it's very lucrative for us, and we expect that to be announced by the RBI sometime this financial year, so between now and the 31st of March 2025. And as said, in this business, we'll be rolling out an additional 4,000 ATMs organically, and we also have a number of acquisitions that are highly advanced. Those acquisitions will add somewhere between 5,000 and 10,000 ATMs conservatively by the end of this financial year. When we have those fully signed, we'll announce details on that. The digital side of the business, as mentioned, this presentation is obviously a little bit out of date for the growth side. As at May, we had 28,000. As I've just reported earlier, we currently have 34,000 locations with more than 3,000 put on in the last month alone. And we expect every month moving forward to that number of 3,000 to be the new baseline and accelerate through the tail end of this financial year. As said, we're targeting 60,000 locations by the end of this financial year. But more importantly, all of these merchant locations are going to be turning into digital finance hubs. And if we can deliver on the potential banking partnership that I mentioned earlier, we'll have a significant increase in products that we'll be able to sell through that network with guaranteed minimums in that partnership as well, which is fantastic. It'll be the first of its kind that we're aware of in India. We've had a new head of white label ATMs appointed. And we're building out the C-suite on that side of the business, as well as our Findi Pay side, which is where we're at now. We're really positioning ourselves for digital growth, of the growth of the digital business over the next 12 to 24 months. Our target for when we list at the tail end of calendar year 2026 is for digital revenues to be between 15 and 30% of total revenue for the group. And that leads me to the Indian IPO offering. So if we can deliver on that strategy, on the numbers that we delivered or announced for the FY24 year, as I already mentioned, that implies a market cap of somewhere between 600 and 900 million on market cap of 600 to 900 million, that is correct. But between now and FY26, there'll be significant growth in our numbers. FY25 forecast, as said, is coming out tomorrow. 25 is the year of investment for us, getting ourselves ready for what can only describe as an exponential year of growth for FY26, ahead of the IPO at the tail end of that year, where we'll be looking to list off an FY27 number. So if we can deliver that, there's a significant re-rate potential from our current multiple, which is 5 times historic, versus our listed peers in India, which is 25 times multiples and higher. Thank you very much.
Thank you very much, Mr. Smedley, and that is Findi. And thank you, sir. As always, you can go out and have a chat with our presenters. So that's our first 5 companies. We've got 14 more to go. A couple of highlights for you. In the next little segment, you'll find out what a pregnant cow has to do with the success of your next holiday, and it could affect millions of people around the globe. Also got a really interesting conversation going on about Bitcoin. It was the talk of our presentations yesterday at Sydney. So if you're interested in Bitcoin, make sure you're here for Lisa Wade's discussion at 12:15. And our final session, we've got just some amazing ones, including Blink Lab, which if you know of anyone who has autism or a family member with autism, it really is a game changer. I've got a niece and a nephew who are both autistic, and the way this will transform the diagnosis of these conditions and early intervention will be life-changing for so many people. And that is a big challenge for people all around the globe, so it's got big legs. And that's the one Brian Leedman's doing as well, a little bit later in the afternoon. And I've got some information for you that you asked me about last year's presentation. Go and enjoy morning tea. You hear the bell, and we'll get you all back in